The human immunodeficiency virus, HIV, is the causative agent of the severe illness known as HIV, which mostly affects the immune system. The immune system, sometimes known as the body's army, is responsible for providing protection against a wide variety of illnesses as well as certain forms of cancer. It is the CD4+ cells of the immune system that are the primary targets of the virus. Macrophages, monocytes, dendritic cells, and T helper cells are all examples of these types of cells. The death of these cells is a consequence of infection, which also gradually weakens the immune system of the individual, leaving them more susceptible to a variety of illnesses. Reproductive contact, including both vaginal and anal contact, is the most prevalent pathway via which HIV infection is passed on from one person to another. Not only may HPV be passed on from mother to kid during pregnancy, but it can also be passed on during nursing. Additional means of infection include contaminated blood, blood products, organ donations, and contaminated needles, particularly in instances of intravenous drug misuse, injections, and needle stick injuries. Another form of transmission is by exposure to infected needles. It is critical to emphasize that individuals cannot contract the virus through routine daily interactions, including embracing, hugging, shaking hands, or sharing personal items, food, or water. Let's now talk about HIV's early warning indicators. Early detection of these symptoms can result in timely testing and treatment, which is essential for efficient virus management. Number 1. Unexplained fatigue. Additional early warning signs of HIV include persistent tiredness that cannot be explained. There is no relief from this kind of exhaustion via rest, and it can have a substantial impact on day-to-day activity. Number 2. Night sweats. Night sweats that cause your clothing and sheets to become drenched, even when the temperature in your room is low, might be a sign of HIV infection. The occurrence of these night sweats can be rather regular, and they are typically unrelated to either physical activity or the temperature outside. Number 3. Quick loss of weight. Another early symptom of HIV is wasting syndrome, which is characterized by fast and unexplained weight loss on a regular basis. Even if you are eating and exercising as you normally would, this is still a possibility. Number 4. Flu-like symptoms. The appearance of symptoms similar to the flu, which can occur anywhere from 2 to 4 weeks after contact, is one of the early indicators of HIV infection. Acute retroviral syndrome, ARS, or initial HIV infection is the term used to describe this condition. A red rash, fever, chills, night sweats, muscular pains, a sore throat, exhaustion, and enlarged lymph nodes are some of the symptoms that an individual may experience. Number 5. Continuous diarrhea. The presence of persistent diarrhea that continues for more than a few days and does not have a known explanation can be an early indicator of HIV infection. If it is not controlled appropriately, this can result in severe weight loss as well as potential dehydration. Number 6. Swollen lymph nodes. Lymph nodes that are swollen, particularly those that are located in the neck, armpits, and groin, can be an early indicator of HIV. This happens as a result of the lymph nodes being a component of the immune system and exerting a great deal of effort to prevent the infection from spreading. Number 7. Oral thrush. Infections of the mouth caused by fungi, known as oral thrush, are quite frequent in individuals who have compromised immune systems, such as those who are in the early stages of HIV. It manifests itself as white spots on the tongue and within the mouth when it is present. Number 8. Sores and rashes on the skin. The early stages of HIV are characterized by the presence of skin rashes and blisters. There is a possibility that sores could emerge on the mouth, genital area, or anus, and the rash will typically be red, flat, and irritating. It is essential to keep in mind that these symptoms can also be brought on by other disorders. Therefore, if you have one or more of them, it does not definitely signify that you have some kind of HIV. If, on the other hand, you are experiencing these symptoms or have any reason to believe that you may have been exposed to the virus, it is imperative that you be tested as soon as possible. Individuals who are living with HIV can see a considerable improvement in their quality of life and health outcomes if they receive treatment and early identification. Have you found this video helpful? Please click the like button and subscribe to our channel so that you may watch further helpful videos that are similar to this one. Our goal is to ensure that you are healthy, so thank you for watching.